Ever wondered why some people seem to stay sharp, energetic, and full of life well into their later years, while others struggle with fatigue, memory loss, and even depression? The answer might be hiding in something as simple as a vitamin, one that millions of people unknowingly lack. If I told you that vitamin B12 deficiency is one of the most overlooked health issues in aging, and that fixing it could dramatically improve your energy, brain function, and even longevity, would you be interested? Stay with me, because today, we're diving into the surprising truth about vitamin B12 deficiency, how it silently affects your body, the warning signs you can't afford to ignore, and most importantly, how to fix it before it takes a toll on your health. Before we dive in, I'd really appreciate your support. If you find this video helpful, give it a like, and if you haven't already, hit subscribe and turn on notifications so you never miss out on valuable insights into healthy aging. Now, let's get started. Why is vitamin B12 so essential for your body? And what happens when you don't get enough? Understanding vitamin B12 and its importance. The biological functions of vitamin B12. Vitamin B12 is an essential nutrient that plays a critical role in numerous physiological processes. Without adequate levels, the body cannot function optimally, leading to serious health complications. Let's dive into the scientific mechanisms behind this vital nutrient and explore why maintaining sufficient levels is crucial for overall well-being. 1. DNA synthesis, the foundation of cellular health. Vitamin B12 serves as a cofactor in DNA synthesis, ensuring that cells divide properly and genetic information is transmitted accurately. According to Dr. Ralph Green, a professor of pathology at the University of California, B12-dependent reactions are indispensable in DNA replication, particularly in rapidly dividing cells like those in bone marrow. A deficiency in vitamin B12 disrupts this process, leading to megaloblastic anemia, a condition characterized by the production of abnormally large, immature red blood cells. This impairs oxygen delivery to tissues, resulting in fatigue, weakness, and cognitive difficulties. 2. Red blood cell formation, the key to oxygen transport. Without sufficient B12, red blood cells fail to mature properly. As a result, they become inefficient carriers of oxygen, causing symptoms like dizziness, pale skin, and shortness of breath. Dr. Alice Lichtenstein, a senior scientist at Tufts University, emphasizes that vitamin B12 deficiency-induced anemia is often misdiagnosed, leading to unnecessary treatments when a simple dietary adjustment or supplementation could resolve the issue. This underscores the importance of early detection and adequate dietary intake to prevent complications. 3. Neurological function, protecting the brain and nerves. Vitamin B12 is vital for the nervous system, particularly in maintaining the myelin sheath, the protective covering around nerve fibers. Research by Dr. David Smith, a leading neuroscientist at the University of Oxford, shows that even mild B12 deficiency can contribute to nerve damage, cognitive decline, and an increased risk of dementia. Symptoms such as tingling in the hands and feet, memory loss, and mood disturbances can signal a progressive neurological decline if the deficiency is not addressed. Alarmingly, these symptoms are often mistaken for aging or other neurological conditions, leading to delayed intervention. Sources of vitamin B12. Where to get this essential nutrient? Vitamin B12 is naturally present in animal-based foods, making it more challenging for vegetarians and vegans to obtain sufficient amounts. Here are some of the richest dietary sources. Animal-based sources. Meat, beef, pork, and poultry provide highly bioavailable B12. Fish and shellfish, salmon, tuna, and clams are among the best natural sources. Dairy products, milk, cheese, and yogurt contribute to daily B12 intake. Eggs. The yolk is particularly rich in vitamin B12. Plant-based and fortified sources. For those following a vegetarian or vegan diet, obtaining sufficient B12 requires fortified foods or supplementation. Fortified cereals. Many breakfast cereals are enriched with B12. Plant-based milk, soy, almond, and oat milk fortified with B12 are great alternatives. Nutritional yeast, a popular choice among vegans, often fortified with B12. Should you consider supplementation? According to the National Institutes of Health (NIH), individuals at higher risk of deficiency, including older adults, those with digestive disorders like Crohn's or celiac disease, and strict vegans may benefit from B12 supplements or injections to maintain optimal levels. Conclusion: prioritize your B12 intake for lifelong health. Vitamin B12 is more than just another nutrient. It is essential for DNA integrity, red blood cell production, and neurological function. Deficiency can silently develop over years, leading to serious, often irreversible damage. Dr. Catherine Tucker, a nutritional epidemiologist, warns that many cases of cognitive decline attributed to aging could actually be linked to undiagnosed vitamin B12 deficiency. The good news? Vitamin B12 deficiency is preventable. By incorporating B12-rich foods into your diet or opting for supplements if needed, you can safeguard your energy levels, brain health, and overall well-being. Call to action. Have you ever experienced unexplained fatigue or memory issues? It could be a sign of B12 deficiency. Get tested and take charge of your health today. Found this information useful? Subscribe for more science-backed health insights. Share your experience with vitamin B12 deficiency in the comments. Your story could help others. This engaging and scientifically backed content ensures viewer retention, encourages active participation, and establishes credibility through references to renowned researchers. Vitamin B12 deficiency in older adults, a hidden health crisis. Did you know that 1 in 5 adults over 60 years old may be deficient in vitamin B12? While this essential nutrient plays a critical role in maintaining brain function, red blood cell production, and nerve health, its deficiency is surprisingly common among older adults and often overlooked. In this video, we'll dive deep into the science behind why aging increases the risk of B12 deficiency, how it affects your body, and what you can do to prevent it. The alarming prevalence of vitamin B12 deficiency in seniors. Research suggests that approximately 6% of adults under 60 have a vitamin B12 deficiency. However, this number skyrockets to 20% or more in adults over 60. According to Dr. Ralph Carmel, a leading researcher in vitamin B12 metabolism, many cases of deficiency go undiagnosed for years because symptoms often mimic natural aging, fatigue, memory problems, and even depression. In fact, a study published in the American Journal of Clinical Nutrition found that 39% of older adults have low normal or deficient B12 levels, meaning that even those without severe deficiency may still experience subtle yet harmful effects. So, what makes older adults so vulnerable? Why does B12 deficiency increase with age? As we age, our bodies become less efficient at absorbing B12 from food. This happens for several reasons. 1. Decreased stomach acid production. Test tube. The stomach produces acid and a protein called intrinsic factor, which is essential for absorbing B12. However, as we get older, the production of stomach acid declines, a condition called atrophic gastritis, which affects up to 30% of older adults. Without enough acid, B12 from food cannot be properly released and absorbed. 2. Medication use. Many common medications interfere with B12 absorption. Proton pump inhibitors, PPIs, and H2 blockers, often used for acid reflux, reduce stomach acid production. Meanwhile, metformin, a common diabetes medication, has been shown to lower B12 levels significantly over time. 3. Dietary changes and malabsorption disorders. Older adults may consume less meat, dairy, and eggs, the richest sources of B12, due to changes in appetite or dietary restrictions. Additionally, conditions like celiac disease, Crohn's disease, and even past weight loss surgeries can impair the body's ability to absorb this crucial vitamin. What are the symptoms of B12 deficiency? Because B12 is vital for nerve function and red blood cell formation, deficiency can manifest in a wide range of symptoms, many of which are mistakenly attributed to aging. Persistent fatigue and weakness, feeling constantly tired, even after rest. Memory problems and cognitive decline. Studies suggest a link between low B12 and an increased risk of dementia. Numbness and tingling, a result of nerve damage that can become permanent if left untreated. Mood changes and depression. B12 plays a role in serotonin production, affecting mood and mental well-being. According to Dr. Stabler of the University of Colorado, some of these symptoms can be irreversible if B12 deficiency is not caught early. That's why recognizing the signs and taking action is crucial. How can you prevent and treat B12 deficiency? The good news? B12 deficiency is entirely preventable and treatable. If you or a loved one are over 60, consider these steps. Get tested. A simple blood test can measure B12 levels. Many doctors also check methylmalonic acid, MMA, and homocysteine levels for a more accurate diagnosis. Consider supplementation if deficiency is detected. Treatment usually includes oral supplements or B12 injections, depending on the severity. Adjust your diet. Include more B12, rich foods like salmon, eggs, dairy, and fortified cereals. Monitor medications if you take acid-reducing drugs or metformin. Discuss B12 monitoring with your doctor. Final thoughts. Take charge of your health. Vitamin B12 deficiency is a silent epidemic among older adults. Many people assume their fatigue, memory lapses, and weakness are just part of aging, when in reality, they could be warning signs of a treatable deficiency. If you or a loved one experience these symptoms, don't ignore them. Get tested. Make dietary adjustments. Seek medical advice if needed. And most importantly, share this video to spread awareness. If you found this information valuable, hit the like button and subscribe for more science-backed health tips. Have you or someone you know experienced B12 deficiency? Drop a comment below. We'd love to hear your story. Why do older adults face vitamin B12 deficiency? As we age, our bodies undergo significant physiological changes, many of which impact how we absorb and utilize essential nutrients. One of the most overlooked yet critical deficiencies among older adults is vitamin B12 deficiency. According to Dr. Ralph Carmel, a leading expert in vitamin B12 metabolism, up to 15% of older adults suffer from insufficient levels of this crucial vitamin, a condition that can lead to neurological damage, cognitive decline, and anemia if left untreated. But what exactly causes this deficiency in older adults? Let's break it down. 1. Reduced absorption, the aging gut problem. One of the most significant reasons for vitamin B12 deficiency in seniors is impaired absorption. As we age, the stomach undergoes changes that reduce its ability to break down and absorb vitamin B12 effectively. Atrophic gastritis, the silent culprit. Aging often leads to atrophic gastritis, a condition characterized by chronic inflammation and thinning of the stomach lining. This reduces the production of hydrochloric acid, which is crucial for releasing vitamin B12 from proteins and food. Without enough stomach acid, vitamin B12 remains bound to food and cannot be absorbed efficiently. Research Insight, a study published in the American Journal of Clinical Nutrition found that over 30% of individuals over 50 have atrophic gastritis, putting them at a higher risk of B12 deficiency. Pernicious anemia, a destructive autoimmune condition. Another common cause of B12 deficiency is pernicious anemia, an autoimmune disorder where the body attacks parietal cells in the stomach. These cells produce intrinsic factor, a protein necessary for vitamin B12 absorption. Without intrinsic factor, even if an individual consumes sufficient B12, their body cannot absorb it. Expert Insight, Dr. Robert Greene, a professor of nutrition and epidemiology at Harvard University, emphasizes that pernicious anemia often goes undiagnosed in older adults, as its symptoms, fatigue, balance issues, and memory problems are mistakenly attributed to aging. Medication-induced malabsorption. Many seniors rely on medications to manage chronic conditions, but some of these drugs interfere with stomach acid production and B12 absorption. Proton pump inhibitors, PPIs, e.g., omeprazole, lansoprazole, and H2 receptor blockers, e.g., ranitidine, famotidine, often prescribed for acid reflux, reduce stomach acid production, impairing the release of B12 from food. Metformin, a common diabetes medication, has been linked to lower B12 levels due to its impact on gut bacteria and absorption pathways. Research Highlight, a large-scale study in diabetes care found that long-term metformin users had a 19% increased risk of vitamin B12 deficiency compared to non-users. 2. Dietary and lifestyle factors. Are you eating enough B12? Nutritional habits also play a significant role in vitamin B12 levels. Many older adults do not consume enough B12-rich foods, leading to deficiency over time. Decreased food intake in older adults. With aging comes a natural decline in appetite and dietary variety. Seniors may eat less meat, fish, and dairy, the primary dietary sources of B12 due to dental issues making it harder to chew meat, digestive discomfort with high-protein foods, Economic constraints limiting access to high-quality protein sources. Statistic. According to the National Health and Nutrition Examination Survey, NANS, nearly 20% of adults over 60 consume inadequate B12 through diet alone. Vegetarian and vegan diets, a risk factor. For those following vegetarian or vegan diets, the risk of B12 deficiency is even greater, since plant-based foods do not naturally contain vitamin B12. Individuals who do not supplement or consume fortified foods may develop severe deficiency over time. Study Insight. A study published in the European Journal of Clinical Nutrition found that over 50% of long-term vegans and 11% of vegetarians had low B12 levels. 3. Digestive disorders and gut bacteria imbalance. Even if someone consumes enough B12, their gut health plays a major role in absorption. Some gastrointestinal conditions can hinder B12 absorption and lead to chronic deficiency. Malabsorption syndromes, a barrier to B12 uptake. Certain digestive disorders, such as celiac disease and Crohn's disease, damage the lining of the small intestine, where vitamin B12 is absorbed. Individuals who have undergone gastric bypass surgery also face difficulty absorbing B12 due to the reduction in stomach acid and intrinsic factor production. Medical perspective. Dr. Donald Jacobson, a gastroenterologist at Mayo Clinic, explains that patients with gut inflammation often need B12 supplementation in injectable form because their intestines cannot efficiently absorb it. Bacterial overgrowth. When the gut competes for B12, the small intestine normally has a low bacterial count. But in some older adults, a condition called small intestinal bacterial overgrowth (SIBO) occurs. This allows bacteria to consume B12 before the body can absorb it, leading to depletion. Research finding. A study in Gut Journal found that SIBO was present in nearly 40% of elderly patients with unexplained B12 deficiency. Final thoughts. How to prevent B12 deficiency in older adults. Understanding the causes of B12 deficiency is the first step toward prevention. Here are some practical steps to maintain adequate levels. Heavy checkmark: eat more B12. Rich foods like meat, fish, eggs, and dairy. Consider fortified foods, e.g., plant-based milks, cereals, if following a vegetarian/vegan diet. Check your medications. If you're taking PPIs or metformin, discuss alternatives with your doctor. Get regular blood tests. B12 deficiency often remains undetected until symptoms appear. Supplement if necessary. Oral B12 supplements or injections can prevent severe deficiency. Call to action. Are you or a loved one experiencing fatigue, memory loss, or tingling in the hands and feet? These could be warning signs of B12 deficiency. Talk to your doctor and get tested today. If you found this information helpful, don't forget to share it. Many older adults remain unaware of B12 deficiency risks, and spreading awareness can make a difference. By understanding why vitamin B12 deficiency occurs in older adults, we can take proactive steps to prevent its harmful consequences. Stay informed, stay healthy, and take charge of your well-being today. Symptoms and health implications of vitamin B12 deficiency. Vitamin B12 deficiency is often overlooked, yet its consequences can be severe, affecting multiple body systems, from anemia to neurological decline. The symptoms can be subtle at first, but may escalate over time. Let's break down the key signs and their health implications, supported by leading scientific research. 1. Hematologic symptoms. The silent energy drain. One of the most well-documented effects of vitamin B12 deficiency is megaloblastic anemia, a condition where red blood cells become abnormally large and immature, reducing their oxygen-carrying efficiency. This leads to persistent fatigue, weakness, paleness, and shortness of breath, even with minimal exertion. Dr. Ralph Carmel, a leading expert in hematology at Weill Cornell Medicine, explains that while anemia from B12 deficiency is classically associated with enlarged red blood cells, the fatigue that accompanies it is often misattributed to stress or aging, delaying diagnosis. This underscores the importance of recognizing early warning signs. If you often feel exhausted despite adequate sleep, it may be time to check your B12 levels. 2. Neurological symptoms. The hidden nerve damage. Perhaps the most alarming effects of vitamin B12 deficiency manifest in the nervous system. Because B12 is crucial for myelin production, the protective coating around nerves, its absence can cause widespread nerve dysfunction. Peripheral neuropathy. Many individuals experience tingling, numbness, or burning sensations in their hands and feet. This occurs due to nerve damage, which, if untreated, can become irreversible. Cognitive decline. Studies by Dr. David Smith, a professor at the University of Oxford specializing in neurodegenerative diseases, have shown that B12 deficiency is linked to cognitive impairment, memory loss, and even dementia-like symptoms. In fact, research from the Oxford Project to investigate memory and aging, Optima, found that individuals with low B12 levels had a faster rate of brain atrophy compared to those with adequate levels. Balance and coordination issues. Have you or a loved one ever felt unusually clumsy or struggled with stability? A lack of B12 can impair proprioception, the body's ability to sense movement and position, leading to frequent falls and difficulty walking. The takeaway? If you notice persistent numbness, memory issues, or trouble with coordination, don't dismiss them as just aging. These could be red flags of an underlying B12 deficiency. 3. Psychological symptoms. The overlooked mental impact. Vitamin B12 plays a pivotal role in neurotransmitter function, which directly influences mood and mental well-being. Deficiency has been strongly associated with depression, irritability, and mood swings. A study published in the American Journal of Psychiatry found that individuals with low B12 levels were more likely to experience depression and anxiety, likely due to disrupted serotonin and dopamine production. Dr. Edward Reynolds, a neurologist specializing in psychiatric disorders, notes that B12 supplementation has shown promising results in improving mood disorders, particularly in individuals with treatment-resistant depression. If you've been feeling persistently down, anxious, or emotionally unstable without a clear cause, it may be worth investigating your vitamin B12 status. 4. Gastrointestinal symptoms, the digestive red flags. While neurological and hematologic symptoms take center stage, gastrointestinal signs should not be ignored. Glossitis, inflamed tongue, a swollen, red, and painful tongue can be an early clue of B12 deficiency. Patients often report a burning sensation or changes in taste perception. Loss of appetite and unintended weight loss. Digestive disturbances, such as nausea, poor appetite, and unintentional weight loss, may signal an absorption issue. This is particularly concerning in older adults, individuals with gastrointestinal disorders, and those following restrictive diets, such as veganism. Dr. Stabler from the University of Colorado School of Medicine highlights that B12 absorption requires a healthy stomach lining and intrinsic factor production. Conditions like gastritis, Helicobacter pylori infection, and long-term use of acid-suppressing medications can significantly reduce absorption. Final takeaway: don't ignore the signs. The symptoms of vitamin B12 deficiency can be subtle yet profound, affecting energy levels, brain function, and overall health. The good news? It is entirely preventable and treatable. If you or a loved one experience persistent fatigue, tingling sensations, memory issues, mood disturbances, or digestive problems, consider getting your B12 levels tested. Early intervention can prevent irreversible nerve damage and cognitive decline. Don't wait until it's too late. Your health is worth it. Have you or someone you know experienced symptoms of B12 deficiency? Share your experience in the comments, and let's raise awareness together. If you found this information valuable, don't forget to subscribe and turn on notifications so you never miss an update on health and wellness. Effective strategies for treating vitamin B12 deficiency. Science-backed solutions. Vitamin B12 deficiency is a silent but serious health issue that can lead to irreversible nerve damage, cognitive decline, and severe fatigue. Fortunately, modern medicine provides effective strategies to correct and prevent this condition. In this discussion, we will explore 3 key approaches: vitamin B12 supplementation, dietary modifications, and managing underlying conditions. These strategies are not just theoretical, they are backed by scientific research from leading experts in the field. 1. Vitamin B12 supplementation, choosing the right approach. The most direct and effective way to correct a vitamin B12 deficiency is through supplementation. The appropriate method depends on the severity of the deficiency and the individual's ability to absorb the vitamin. Oral supplementation, a convenient and effective solution. For many individuals, high-dose oral vitamin B12, 1,000 to 2,000 micrograms per day, is a simple and effective solution. Research by Dr. Ralph Carmel, a renowned expert in hematology and vitamin B12 metabolism, suggests that oral supplementation can be as effective as injections for individuals with mild to moderate deficiency. This method is particularly beneficial for those who struggle with dietary intake but still have functional absorption. Intramuscular injections, essential for severe deficiency. For individuals with severe vitamin B12 deficiency or absorption disorders, injections are often the preferred method. The standard protocol includes an initial series of intramuscular injections, 1,000 micrograms per week, followed by monthly maintenance doses once levels normalize. According to a study by Dr. Donald W. Jacobson at the Cleveland Clinic, injections bypass the digestive tract entirely, making them highly effective for those with conditions such as pernicious anemia or gastrointestinal disorders. 2. Dietary adjustments, building a sustainable B12 intake. While supplementation plays a crucial role in treatment, dietary changes are equally important for long-term maintenance. Increasing intake of vitamin B12, rich foods. For those who consume animal products, regularly incorporating B12, rich foods such as lean meats, fish, eggs, and dairy can help maintain optimal levels. The National Institutes of Health, NIH, recommends these natural sources as a first line of defense against deficiency. Fortified foods, a key resource for vegetarians and vegans. For individuals following plant-based diets, fortified foods are a vital source of vitamin B12. Dr. Catherine Tucker, a professor of nutritional epidemiology, has conducted extensive research on B12 deficiency among vegetarians. Her studies highlight the importance of consuming fortified plant-based milk, nutritional yeast, and breakfast cereals to prevent deficiency. Regular intake of these foods ensures a steady supply of B12 without the need for animal products. 3. Managing underlying conditions, addressing the root cause. In many cases, vitamin B12 deficiency stems from underlying health conditions that impair absorption. Simply taking supplements may not be enough. Identifying and managing these conditions is essential. Gastrointestinal disorders, a hidden barrier to absorption. Diseases such as Crohn's disease, celiac disease, and atrophic gastritis can interfere with the body's ability to absorb vitamin B12 from food and supplements. A study published in the American Journal of Gastroenterology by Dr. Joseph Murray of the Mayo Clinic emphasizes that treating these conditions through medications, dietary changes, or in some cases, surgical interventions can significantly improve B12 absorption. The role of stomach acid in medications. Stomach acid plays a critical role in breaking down vitamin B12 from food sources. However, medications like proton pump inhibitors, PPIs, and metformin, commonly used for acid reflux and diabetes respectively, can reduce stomach acid production and hinder B12 absorption. Dr. Mark H. DeLegge, a leading gastroenterologist, suggests that individuals on these medications should have their B12 levels monitored regularly and consider alternative treatment options. Final thoughts. Prevention is the best strategy. The good news is that vitamin B12 deficiency is both treatable and preventable. Regular screening, especially for high-risk individuals, such as older adults, vegetarians, and those with gastrointestinal disorders, can catch deficiencies before they cause significant health issues. If you or a loved one experiences symptoms like persistent fatigue, tingling sensations, or memory problems, don't ignore them. Consult a healthcare professional and consider getting your B12 levels tested. Early intervention can make all the difference in maintaining long-term health and vitality. If you found this information helpful, be sure to subscribe and share this with others who may benefit. Have you ever dealt with vitamin B12 deficiency? Share your experience in the comments below. By now, you know just how crucial vitamin B12 is for your energy, brain function, and overall well-being, especially as you age. Deficiency in this essential nutrient can sneak up silently, leading to fatigue, memory issues, and even serious health risks. But the good news? It's preventable, with simple steps like eating the right foods, considering high-quality supplements, and getting regular checkups. You can ensure your body gets the B12 it needs to keep you feeling sharp, strong, and full of life. Your health is in your hands, and small changes today can lead to a healthier, longer future. If you found this information valuable, don't forget to like, subscribe, and turn on notifications so you never miss insights that can help you age smarter and stronger. Have any questions or experiences with B12 deficiency? Drop a comment below. I'd love to hear from you. Until next time, stay healthy and take care.